Hi, Jabril. Hello.
How are you?
I'm doing well. How are you doing?
I'm good. Busy.
Good, good. All right, cool. So it might be useful today to, if you want to just begin with like a brief announcement about the next community service session and the
Okay.
groups, because people are continuing to be confused on WhatsApp about it, which is totally understandable. There's a lot of moving pieces with that. So I think that would be helpful.
Okay. So yeah, let's see. So the 22nd,
Mhm.
the groups are already divided and they already sort of I guess what I need to clarify is I think they already know this, that they're working on as a group on one presentation around a theme. And then during the discussion, they each will talk about the unique aspects of their own work. And that would be the time for individuals to say, well, in Uganda, I'm doing this related to child services. In Kenya, I'm doing this, because that gives them an opportunity to sort of speak more about their personal work. But the presentation is just supposed to be centered around one theme, and they all kind of put it together. So hopefully that's clear, but I'll clarify that today.
I think it'll be useful we'll do an announcement and then I'll reinforce that with my email on Friday, and then it'll all be crystal clear by next week. But yeah.
No, I just had so much going on. I mean, I just realized it was just like, I shouldn't be messaging when I'm multitasking.
Yeah, no, it's hard. I understand. Let's see. We've got.
Okay, I have not checked the email. I'm sure there's a bunch of emails going on.
There's a bunch of emails, and I've been trying to keep up with WhatsApp too. Another issue we might think about, I don't know that we have to say anything about it today, but we might think about the accountability partners issue, because I feel like a lot of people haven't gotten accountability partners. And I don't know exactly, but it might be useful. I know that they're supposed to find their own partners, but it might be useful for us to take more of a hands-on role with that. I don't know how you want to proceed with that. If you want me to ask them to email us and we can partner them, or I really have no idea what's happening with accountability partners. I'm just hearing a lot of complaints that that people don't have them. So
I mean, I have no idea. I think we could, Christina's here, we could solicit Cammie's help the same way she organized the community service.
Yeah, that would
we can get her to sort of create a file, and those that are pairing, and she would just identify them and email us the list. I think that might be.
Do that. That's a good idea.
I think it's a better use of our time.
Yeah, because I know, well, I'm just trying to think pedagogically too, because I know that they were supposed to be, it's part of their networking. They're supposed to be finding them on their own, but it's just so difficult with the digital format that I think we might help them a little bit more than we usually would. So, okay, I will ask Cammie about that, or we can ask her when she comes into the meeting, but we'll.
I think that might be. And she can organize it very well, the same way she organized the community service was very impressive. And then she'll give us just a file or an email, because I have no idea who's doing what with whom.
Right, yeah, exactly.
So you want to speak to that? I'll talk about the community service announcement. You can talk about the accountability. Let me see who's here. Okay, let me let Christina in. Christina is one of our presenters, and June, unless they log in the same. Christina. Hi, Christina, how are you? Christina, can you hear me?
Hello, Christina.
I don't think she has
audio. She's still connecting.
Okay.
Hi, Christina, can you hear us?
Christina, hi.
I guess not yet. One other thing, she's in the waiting room again. I think she's on two.
Oh, she's probably logging in with 2 different devices.
Yeah, so we also, Kemi just sent an email that Chisholm is ill and she's in the hospital right now.
Okay.
So let's reach out to her later. And Shaba said she just got in a minor car accident, but she's going to be getting on the phone as soon as she can. So
Okay.
it's a rough day. Okay.
Oh, I know. Hi, Christina, how are you? Can you hear us? We can hear you. You have no audio. Still, we can't hear you still, no audio. Christina, you have no audio. We still can't hear you. Do you want to join? Do you want to leave and join again with audio and video able?
Yeah, we can't hear you.
We can't hear anything you're saying.
Yes, you might want to close Zoom and just close out the call and reconnect and see if that works.
Let me just send a message on. Hi, Christina. We are not able to hear you. Okay, so I think those are the only, so Chisholm, hopefully she'll be okay.
Yeah.
And
yeah, I'm sorry, I'm just checking in with some other, we've gotten a lot of emails about stuff.
yeah, I really haven't looked at email. My daughters have summer enrichment academy in the morning, so I was trying to get that straightened out before.
Hello, Dr. Solomon. Can you hear me?
Hello.
Oh, there we go.
We can hear
Christina,
you
how
now.
are you?
Right.
Good. I'm just having some technical difficulties. So the Zoom link that I've shared with some of our office staff says authorized attendees only. So is it only open to me, June, and Betsy, or are other individuals able to access and get into the link as well?
I mean, they should be able to. Can you put their emails on the can you send me their emails on the chat?
Okay, that's going to be way too much because I did an open invitation to people who wanted to partake. So
Okay.
that might be too much, too many individuals for me to do.
Okay. Let me see.
So I just tried joining again.
Yes, I have someone on the phone, Dr. Solomon, trying it out. That didn't.
Great.
That's not me and not June. And
yes. So so just to add on to that, so
So
Drill,
I
I think you have that as a setting.
login
So
information.
under settings.
But I did this login and it says
Security
this link
settings.
will let
And
you join
then,
in.
sorry, near
Go ahead.
the bottom of that, there's an option only authenticated users can join meetings.
Under
I
where?
would turn that off. So it's in the settings page on Zoom.
Settings page
It's
on the
yeah,
link?
so you can click when in Zoom, you can click on the little green shield. And then on the little wheel, so you click on the green shield, it says what meeting we're in right now. And then there's a little shield, whatever, that little
So let me.
flower, whatever that thing's supposed to be.
All right, thanks, Sarah. I'll
Okay,
let
let's problem
you
solve. So
try with somebody else
I'm in
too.
Zoom. You want me to click on what?
Thank you.
Okay, so
Thank
the
you.
general, the symbol for the settings, right? So click on the green shield at the top and then the thing in the right-hand corner, the wheel. Click on that. And that'll take you to your settings.
I am not seeing that. Okay, let's see. Zoom in progress. Meeting, chat, home. Today's meeting one. Let's see. Today's meeting.
So yeah, just on the screen for our general Zoom meeting with the gallery, click on the green shield in the upper left-hand corner next to the recording.
Oh, the Zoom we're already on?
Yeah, the Zoom we're on. Yeah, so just go to the little green shield, click on
Okay,
that,
yeah.
and then click on the little wheel thing in the right corner of the box.
Oh, the
And that'll
setting,
take you
yeah.
to your settings. Yeah, so then go to general settings.
General,
Yeah, general
yeah.
settings.
Okay,
Bottom of that page, view more settings.
view.
And then it's the first section is about security. So it's toward the bottom of that. Only authenticated users can join meetings.
So if okay, from general, go to what? Viewer setting?
So yeah, so okay, you're in setting, general, and then view
yeah.
more settings underneath the thumbs up reaction skin tone thing. Click on view more settings.
View more settings, there we go.
Okay, and then there you should have a huge list of different settings. Just scroll down until you get to only authenticated users can join. And just turn that off.
Let's see. Oh, wait a second. Wait a minute. Something is up. I'm not doing something right. Okay, so let me. So, okay, let me do this over again. Okay, settings. Overall, general, view more settings. Okay, so under view more settings, go to
only authenticated users can join meetings. Turn that off.
Require password.
Yeah, so it's right under the password.
Require password. Enable passcode link to one-click only. Only authenticated users can join meeting. It's off.
It is off. Okay.
It's not
so
on.
That's weird. Yeah, because I was wondering if you had that checked, because that was Rosina was getting a problem yesterday that she couldn't get on because it said she wasn't authenticated. So I didn't know. Yeah, I was wondering if maybe you had that as a setting.
No,
but
it's off.
You don't have that checked.
No,
so
I don't have that checked.
Okay, so I'm not sure what the problem would be then.
Let me see. Enable personal meeting ID, chat, private chat, feedback, co-host, poll, social screen sharing.
So they have the passcode and everything.
Allow saving screen, allow savings outcome, allow remote control, meeting reaction, all participants rename themselves. Breakouts. I mean, no, it's not. Let's see. Require that all meetings are secure with one secure option, waiting room.
Yeah, I don't think that's a problem.
It's off, so. But this, maybe let me turn it on and turn it back off. Your setting have been updated. But now,
I have someone trying right now to try to get in.
Okay.
okay. So it's
Okay,
off.
so is this Sarah? I'll admit Sarah.
Sarah is one of them.
Okay.
She had a Zoom account, so she was able to get in.
Okay.
But
So I've just admitted Sarah from the waiting room. So hopefully she's all
all
good
right, so
here.
Dream is trying to get in and she's not getting in.
Hmm.
It says authorized attendees.
Because I just made sure that's off.
Mhm. You know.
Even using the password and user password and ID.
I don't think it was allowing us. I think when you go on it, what doesn't it say?
So if I can interrupt you, are people using the email addresses that they received the meeting invitation at? Because that might help.
So yes. So this is what I'm just going to put you on speaker, June, while I'm kind of talking both ways. 1 second. So if I'm going to try to are you able to? Yeah, I can share my screen. So what comes up? Bridgewater wants to see my screen share. Are you able to allow me to share my screen?
Yes. You should be able to share your screen.
More, all right, share screen, entire screen, share. Oh, okay. So what's come up is an error message that's saying this. I don't know if you can see that.
Okay. For authorized, please sign in Zoom with an email address authorizing you to join. Okay. All right.
Yes,
Maybe can she send me an email and then I'll just sort of email her the link. Maybe that will do.
What do you mean? You want me to do? I mean, I could send you a link and change it to my WebEx room if you wanted to send it to the fellows. But I don't know how to change this to get them on your link, because I forwarded that link that you gave me to our staff. And
Okay.
we don't use Zoom as our platform. We use WebEx as our platform. So not all of our workers or attendees will have a Zoom email
Okay.
to log in.
sorry, just to interrupt you here, is so Andrew and Corday, are they from your office? I'll admit that.
Yes. Yep.
Great.
Yep.
Good. They're in the waiting room, so that's good.
They're in the waiting room. That's good. So June,
Yes.
some people are getting in. I'm not sure how some people are getting in.
I have no idea. I can tell you I'm trying to get in. It's still saying meeting is authorized.
DCF move. Guess
I think, to be honest with you, I think they may have Zoom accounts. That could be it.
it could be. Let me ask Corday. Corday, can you hear me, Corday?
I could hear you.
Yeah, did you have a challenge trying to get in your in which option did you choose to get in? Because we're having difficulties where it says authorized user.
I just signed into my Zoom account.
Yeah, Zoom account. Okay. So yeah, we have people that have Zoom accounts, June. So that seems to be the reason why. Like, I have a Zoom account because of being on Bridgewater, and some other people might have Zoom accounts from joining other meetings. I know WebEx is our platform in general. So Dr. Solomon and Megan, I'm not sure how to problem solve a little further, because it just only people with Zoom accounts are then are going to be able to get in.
Yeah.
And
I mean,
not full staff.
unfortunately, we don't use WebEx at Bridgewater. So
Mhm.
if you switch to WebEx, we won't be able to join the meeting and our fellows won't be able to join. So unfortunately, I think probably we're just gonna go with those staff who can attend. And maybe the other staff who cannot attend can call in and listen in. They will be hearing us over the phone, but they won't be able to be on the Zoom.
So my challenge is my two co-presenters, I wanted them on the Zoom. So June and Betsy, I really needed them on.
Okay.
To go
So just,
along with
I'm
the
sorry, just to clarify,
PowerPoint.
Christina, so they've tried to make Zoom accounts with the email
No,
address? in which they-
No, some of our staff do have Zoom accounts,
Mhm.
but some of our staff do not, because
Okay,
Zoom
so
is
can
not
they,
a
okay,
platform that we use.
okay. So can they try, we could maybe, start to get started and they can try to make a Zoom account using their email address where they received the invitation? I'm just letting in a couple more staff. I assume they're your staff that are.
Sure. I think that, so June, do you think you can create a Zoom account? I mean, I don't know if Betsy's gonna be able to do, I mean, we can wing it. I mean, I can wing it. I just wanted at least you and Betsy in.
I know, I'm trying to do it now, honestly. I'll try to make one now.
Okay.
That's awful.
Yeah.
Karen, did you have a Zoom account, Karen?
I'm sorry, what? Do I have a Zoom account?
Did you have a Zoom account? I'm just trying to problem solve how people are getting in, because we're getting that authorized, only authorized people can join
Yes.
message.
I do have a Zoom account.
So you went in with your Zoom account, okay.
Mhm.
You're gonna have to, if you wanna call Betsy, I'm gonna try to make her now and I'll play it back, Christina.
Okay, all right, thank you. So I'm gonna mute myself. I'm gonna have to call at least one of my co-presenters, and I'm gonna probably get a bunch of emails from people now saying they can't join in. So I'm going to unshare my screen. I'm gonna
Okay.
mute myself. I'm just going to send a couple of emails to the staff to use their Zoom accounts if
Okay.
they have one, or if they create one. So give me a second.
Okay, yeah, and
Okay.
Christina,
No.
sorry, thank you. Christina, if you can be sure to tell people to make a Zoom account using the email where they received the invitation. I just Googling about this, that seems to be a good thing that tends to work if people are having trouble with authorized access.
Well, I forwarded the invitation that I got from
Oh,
Dr.
okay. All right,
Solomon.
then that
So,
should,
that's
that shouldn't be their problem. Okay, great.
All right.
okay.
The
So
fellows
we'll
in
do
now.
So
I've just been able
Christina,
to admit others. here.
Yes.
so Christina, we'll give you, we have some announcements to make. So in the next 10,
Mhm.
15 minutes, we're covering our announcements. And
Mhm.
when you're ready, just send me a message on the chat.
Mm-hmm.
Send me a private message on the chat that they're ready to go. And then I will just kind of get that as a signal and we'll get going.
Okay.
All right, so
All right.
we will welcome our fellows and do our intro and all the stuff to get going. And when you're ready, just once I see your message, we'll be good to go.
Okay. Sounds good.
Great.
Good evening, everyone. Welcome. Thank you for your patience with our slight delay here today. So we're going to get started in just a moment with our colleagues from DCF in our first community service session. We've had a little bit of correspondence on WhatsApp and email this morning about the next round of community service sessions, which are happening next week on the 22nd of July. And so with those community service sessions, those are the ones that you'll all be doing the group presentations. So I sent some correspondence about that on WhatsApp earlier today. And I'll also send a reminder about that along with the Zoom links for those group presentations in my end of week email this Friday. Jabril, do you want to say anything else about those presentations for our fellows?
Sure, and I hope you all get my message on WhatsApp clarifying. I know that you all panic when you saw my first email that you were presenting today. So the clarification that I posted on, on WhatsApp is that your community service presentation starts on the 22nd. So on the 22nd, you already have, decided the groups you're going to be joining. You've already sort of organized yourself into groups, and we have the breakdown from Cami, who's doing what. So we have 4 community sessions, and as you know, it's almost like a 2-part kind of a community service presentation. In those 4 sessions, you and your group, depending on if you take youth education and something else, you and your group will gather your thoughts and put together about a 10-minute presentation on issues with youth in Africa, based on your general knowledge. You will sort of compile your knowledge into one presentation. Now, remember, the important thing here is, how do you, 3 to 5 leaders, I think there's 5 of you, how do you work together? How do you communicate together? How do you collaborate together to organize your thoughts around one major theme? So that is your first challenge. So the presentation is not about one of you, sort of every one of you presenting what's happening in your country and it's piecemeal together. That is not how it's going to work. So your challenge with the presentation is 5 of you as leaders working in youth programs will pick and highlight key points, and you take those key points from your 5 countries, synthesize them into one presentation. So you're essentially saying, in our 5 countries in general, here are the main issues going on related to youth and education and social justice. So that's kind of the gist of your presentation. Once the presentations are done, when we move to the discussion forum, now each one of you will be asked to talk about specifically youth programming and intervention that you are doing in your own country. So during the forum discussion is now your opportunity to present something unique, something different about youth programming, youth intervention going on in your own country. Let me take a pause to make sure that everyone is clear. Are there any questions about that? Anybody has any questions?
Dr.
Good.
Jibril,
So that's.
I do have a question, please.
Yes.
I just want to get it straight. So the 10 minutes presentation, will it be pre-recorded or do we present on the live?
No, you present live.
Okay.
So you are presenting live. So essentially what you're going to have is you will prepare a presentation. You can share it from your end or you can send it to us. We will share it like a PowerPoint. And the 5 of you that put it together will decide who's going to talk about what. One person can talk about the introduction, the other person can talk about a little piece, but every 5 of you will say a little piece about what the presentation, the content of the presentation. And then we move to a forum discussion. Now, the backdrop is the community organization that you are presenting to, they will give a presentation about what are we doing in the United States related to youth development and intervention. And they will give you an idea and you will say, wow, in the United States, this is how they do youth development. These are the things, these are the program, these are the policies. So then you present your overview and we go into a discussion. And the discussion will be now, you're giving your unique perspective. Yes, in Kenya, we do this, we have these policies. In Uganda, we do this, we have these policies. So you will have a chance to talk about your unique work when we go to the discussion groups and forum. Good? Everybody's good? Everybody's good with that? All the groups are good with that? And that's how we will know that you actually have performed your community service. All right, it looks like we are set to go. We are ready to go. Everybody's good. June, I see you made it. It's wonderful. How you doing, June? Can you hear us?
Yes, I am. Thank you.
This is beautiful. June is here. Wonderful. And Christina, so let's get into it. Welcome. Good morning, good evening, good afternoon, because people are in different time zones. all over Africa. We are in our afternoon. So today we're going to have a presentation by one of our state agencies, because some of you as fellows work with your government, you work in government settings, you work as state agency representatives. Some of you have to collaborate with state agencies. So today you're going to learn about how in the United States, one of our state agency services works with communities to provide services and support for people. And so one of the state agencies where I've invited today to join us to do a presentation is Department of Children and Family. We call it DCF for short. And it covers all issues, programs, support, services, intervention related to children and families. So without further ado, I am going to invite Christina to introduce herself. And then Christina, would you, after you introduce yourself, would you introduce or invite your co-presenters to introduce themselves? And then after that, we will just dive into your PowerPoint presentation. Christina.
Okay, sounds good. Hello, everyone. My name is Christina Albernaz. I am a supervisor at the Department of Children and Families, where I have been for over 20 years at this point. My co-presenters today are June Reedy, who is another supervisor at the New Bedford Department of Children and Families, and Betsy Gonzalez, who is also another supervisor at our agency. We also have invited other individuals from our agency to partake in the discussion at the end, and also learn from your presentations and hear our presentations. Our presentation is pretty much going to be an overview of our agency, and then it's going to focus down a little bit more on interventions or resources that we utilize and how we work with our families. And it is through a PowerPoint presentation. So I am going to bring that up and we'll start that going. And welcome everybody. So let me bring my PowerPoint up. Can everybody see this?
Yes, it's
Is that a
showing
yes?
now.
Yes.
Yeah.
Okay. Yes. Okay. So again, this is the Department of Children and Families. This presentation specifically is from the New Bedford area office. And the presenters, as we talked about, are myself, Betsy Gonzalez, and June Reedy. And we have divided the presentation in sections where we will all speak and piggyback off one another. So our first slide is, what does DCF do? What do? We receive, we screen, and we respond to reports of abuse and neglect. We also provide assessment and intervention services relative to concerns of abuse and neglect, and provide case management. We have several specialties in adolescent services, adoption and guardianship services, foster care, family support and stabilization, and out-of-home placements. As the Department of Children and Families in the state of Massachusetts, there is a law that indicates that the department has the authority and the responsibility to receive reports of suspected abuse and neglect, to screen them and assign them for investigation by DCF response workers. In addition, the legal authority also indicates that we do have the authority to, one, petition the court for custody of a child if they are at risk of abuse and neglect, in which a judge will make a determination. Or on an emergency basis, we have the authority to remove the child on an emergency basis and then go to court for court custody. So how do we define the law and child maltreatment? This is where I'm going to turn the reins over to Betsy Gonzalez. She is a response supervisor at the agency, and she works at the front door in which these reports come in. And we have a very specific framework in which we operate from to define the law and define child maltreatment. So at this point, I want to pass it over to Betsy Gonzalez.
Good afternoon, everyone. I'm extremely honored to be here. What I'm going to be talking about is the front door process when the reports come in. So we're going to discuss very briefly how the reports come in. Some reports, usually a lot of the reports come in through a mandated reporter. Now, all citizens have the responsibility to report abuse and neglect, but the law requires that certain persons designated as mandated reporters make such reports due to contact with children who may be at risk of abuse and neglect. And I just want to define a mandated reporter could consist of a hospital staff, law enforcement, it could be educational professionals, whether it's guidance counselors, teachers. And I also want to add that there's also reports that we receive that are also considered from non-mandated reporters. That may be an individual like a neighbor or someone that may not be 100% fully in a professional field as well, but anyone can file a report in regards to any concerns of abuse and neglect regarding any children. The next thing we need to look at when we're looking at these reports when they come in is considering the reportable condition. And what that consists of is the information that indicates that a child or children may have been abused or neglected, or may be at risk of being abused and neglected by a caretaker, or that a child may have been at risk of sexual exploitation or human trafficking, okay? And that, we also consider the factors and how this may or may not have occurred. And in order to get to that conclusion, we look at reasonable cause to believe. And what that is it's a collection of facts, knowledge or observations which tend to support or are consistent with the allegations when viewed in light of the circumstances and the credibility of persons providing that relevant information, which would lead us to believe that a reasonable person to conclude that a child has been abused or neglected. So we must know how to define abuse and neglect. So the Massachusetts law defines abuse and neglect and specifies when the Department of Children and Families, also known as DCF, would be justified in intervening when a report is filed or neglect is made. And in order for us to do that, we have to be able to know the difference. So abuse is defined as the non-accidental commission of any act by a caregiver which causes, creates substantial risk of physical or emotional injury or abuse to a child. That victimization can occur through sexual exploitation, human trafficking, and whether or not the person responsible is the caregiver. The definition is not dependent upon the location of where we are going to assume that the injury or the circumstances occurred, because abuse can occur when the child is in or out of the home setting. So abuse is defined as any type of physical injury, substantial risk of physical or emotional injury, or sexual abuse, sexual exploitation, human trafficking, and also emotional injury. So our current law in Massachusetts regarding the use of physical discipline. So physical discipline is allowed in Massachusetts, whether it's discipline by spanking or even using an implement such as a strap or a belt. However, physical discipline, which causes or creates substantial risk of a physical injury to a child, may fall under the department's definition of abuse and could result in a decision to support an allegation of abuse depending on the individual circumstances of the case. And I just want to add, when we're talking about the use of physical discipline, or when we're looking at the internal process of the reports coming into the front door, it's very, very important that we look through and we understand through a cultural lens how each culture comes with what they believe is their use of disciplining a child. And it's important that we learn to explain the difference in the laws, but yet take the culture and the diversity into consideration. So when we're talking about some of these types of abuse, sexual abuse is one that at times is very prevalent. So I'm going to kind of skip around because there's a lot in reference to this. So it's a non-accidental act by a caregiver upon a child that constitutes a sexual offense under the laws of the Commonwealth, or any sexual contact between a caregiver and a child for whom the caregiver is responsible. That could be related, and that can also be non-related. Child abuse is defined as contacts or interactions between a child and an adult in which the child is used for any type of sexual stimulation of the perpetrator or another person. It may be committed by a person under the age of 18 when that person is either significantly older than the victim or is in a power of control over the child. We're also taking into consideration the sexual nature that is inflicted upon a child, whether it causes harm or substantial risk of harm to the child's health or welfare. Physical, verbal, or written. It includes any type of intercourse, oral, genital, anal penetration, and it could be verbal or written sexual contact. Sexually oriented communication that is not reasonably intended to provide information and direction for the child's education and physical and emotional well-being. So in addition to that, we also have the definition of trafficking. So human trafficking, these laws are all based on our Mass General laws, is a person who is subjected to harboring, recruitment, transportation, provision, obtaining, patronizing, or soliciting anyone for the purpose of sex trafficking, inducement to perform a commercial sex act for sexual services and or sexually explicit performance and or labor trafficking for services, involuntary servitude, debt bondage, or slavery. And we are starting to see an intake in a lot of our trafficking. And it usually starts and involves a lot of the technology that we have with cell phones and with a lot of our other additional ways of contacting through the internet as well. So neglect is considered a failure by a caregiver, either deliberately or through negligence, or inability to take those actions necessary to provide a child with minimally adequate food, clothing, shelter, medical care, supervision, emotional stability, and growth, or other essential care. Malnutrition or failure to thrive. Neglect cannot result solely from inadequate economic resources or be due solely to the existence of a handicap condition. We also have what's known as SENS, which is substance exposed newborns. And that is a newborn who was exposed to either alcohol or drugs in utero, ingested by the mother, whether or not this exposure is detected at birth through a drug screen or withdrawal symptoms. A SENS may also be experiencing neonatal abstinence syndrome, which symptoms and signs exhibited by a newborn due to drug withdrawal. NAS is a subset of SENS. Fetal alcohol syndrome, FAS, as diagnosed by a qualified licensed medical profession, is also a substance of SENS. So in consideration to emotional injury, it is an impairment to a disorder of the intellect or psychological capacity of a child as evidenced by observable and substantial reduction in the child's ability to function within a normal range of performance and behavior. Examples include, but are not limited to, severe anxiety, depression, withdrawal, unmanageable behavior, or hostility towards other or self-abusive manner.
So how do families become involved with DCF? Betsy just gave you a rundown, I think, on, the agency has to take a strong position on defining what abuse and neglect means, who are mandated reporters. And now the next step is then what happens? What happens when somebody files a report with our agency and they're alleging whether it's emotional injury, neglect, sexual abuse, sexual exploitation, or physical abuse? So first, I want to start off with the structure of DCF in Massachusetts. So, Massachusetts is a small state, but we do have a pretty sophisticated system with DCF. We have 5 regional offices across the state. We are the New Bedford office, which is down here, if people can see my cursor, and we are in the southern region. But we have 29 area offices statewide. In our New Bedford office, we do have an organizational flow, but most offices follow the same flow with an area director, an area administrative director that takes care of the fiscal responsibilities, a clinical manager, an area program manager, several area program managers, social work supervisors, social work technicians, clerical staff, family networks that we will get into a little later, and specialists for consultation. Social workers in specific within the agency take on a variety of roles. Screeners are the individuals that take those reports that are filed within our agency, and we refer to them as 51A reports, and that correlates with the law and how it is written for the Commonwealth. Then we also have response workers, and response workers are the individuals that actually investigate the reports if they are screened in. Because we talked, as Betsy talked a little bit about, we have to make sure there's a reportable condition. So the screeners ensure that it's a reportable condition and whether the report needs to be screened in or screened out. We have response workers that investigate the reports if they're screened in. We have ongoing social workers. Now, this is the bulk of our agency, the meat and potatoes where the true work with the families gets done. We also have adolescent social workers that work with court-involved adolescents and specialize in adolescent issues. We have family resource social workers, and they train and support in licensed foster homes. And we also have adoption social workers that work on finding and preparing children for permanency in permanent homes if reunification is not an option. And we'll be discussing a little bit of that as we go on with our presentation. So what tends to happen is a report gets filed, if people can follow my cursor, a 51A report is filed with a screener or on hotline. We also have an after-hours hotline system that takes on reports. The report is usually discussed in a screening panel, and a decision is made if it is screened in or screened out. If the allegations do not seem to have merit or are not a reportable condition, then that case just gets closed out. If through the screening panel, the allegations get screened in, it goes into an investigative response. We call that an investigation, also called a 51B. So the 51A is part of the law in which mandated reporters file. 51B is part of the law in which we investigate and provide a response to that report that gets filed. A determination in their investigation will be made on whether the allegations meet one of those reportable conditions, as we talked about earlier, and whether the allegations are, and I apologize, this should be supported or unsupported there. If it is unsupported, it does get closed out. If it is supported, it gets assigned to a social worker. And that's where I have spoken to ongoing social workers, the meat and potatoes and the bulk of where the work that gets done. The social workers will complete a family assessment and action plan called FAAP for short with the family to really identify the strengths and the needs and the worries of the case. At the time of an FAAP, we can close the case if some of the issues have been ameliorated or we no longer become involved, or we can continue with ongoing case management until the issues get rectified and we feel comfortable with closing a case within our agency. So just as a circular kind of model, the intake is the report, the 51B is the response. If the case becomes open, we conduct a family assessment, an action plan. We do ongoing work with the family through the ongoing social workers. And then hopefully our main goal is to close the case. And we no longer have to become involved with the department. But in ongoing, a lot of the work is what gets done with the family right there. And we'll discuss that a little further. So the desired outcomes of our agency is really to safely stabilize and preserve our families. And if the child has to be removed from their family context, our main goal is to safely reunify families. And if for some reason we cannot safely reunify our family, then our goal is to safely create a new family for that child. What we do in the state of Massachusetts, after a child is removed, and if necessary, and not all our cases are court involved, we provide family stabilization there. We also provide placement prevention, and we also do concurrent planning. It begins at the first contact with the family. It includes efforts to safely end our involvement under our plan to stabilize and reunify, while carrying out complementary efforts to ensure that an alternative permanent plan for the child if we cannot stabilize the biological family. That's where what we call concurrent planning. We're almost doing two plans at the same time. We continue both efforts until DCF involvement ends or there is termination of parental rights, and I'll go into that a little bit further. So permanency for our agency is really about describing the intent of why the child is in placement, provide a safe place for that child to live, having that child have some sense of commitment and continuity, the stability of lifetime parental relationships, to at least have one meaningful relationship with an adult, an unconditional commitment and love, a sense of belonging and a safe, stable, secure family relationship, a legal arrangement where possible, and for it to be lifelong. We do believe that children have the right to live and grow in stable and nurturing environments. Hopefully that is with their biological family. If not, it would be with other extended family members. And in other situations, it could be with unrelated adults. And we want to give children a sense of direction. A sense of permanency really provides a child's healthy and emotional and physical development, the opportunity to maintain contact with important persons, including siblings. It helps them promote independent life skills. We do involve youth in the process when they become of a certain age, and connections to their ethnicity and culture. With our agency, we do also follow the federal regulations of ASFA, and that stands for the Appropriate Safe Families Act. Now, what that says is really that the department, all states, but specifically, how we define it in Massachusetts, is from a child, if they need to be removed from their family environment, that the time frame from removal to permanency is achieved within 24 months, and that is a 2-year time frame. And that is so children do not linger in the foster care system longer than what they need to, and that we can provide permanent plans for children. And in order to do that, we have key decision points in cases. So if a family becomes involved with DCF, where our priority is on stabilization. However, if the child does need to enter placement, we do a 6-week review. We do foster care reviews. We have permanency planning conferences, more foster care reviews. We have permanency hearings by the court, permanency planning conferences again, where we have to make a determination if we should initiate termination of parental rights. And by the 15-month mark of the last 22, we must determine whether we should initiate termination of parental rights to give the child a sense of permanency. Or if not, if there is an exception by the state or by the federal regulations in which we can apply in this case. And now many families need more than 24 months, and then that's okay. They may be still in the process of reunifying. They need more time. They're engaging. There might be some systemic or organizational barriers, and we will continue to work with the family. So it's not a hard, fast rule that within 24 months that a child's permanency plan needs to achieve. But what the agency tries to do is keep the timeline intact so we can keep the idea of permanency in the front framework for the child. So when we talk about some of these, concepts of reviewing for permanency, one of our things is a 6-week placement review. So if a child does enter care, we have a 6-week placement review where the parents come, a child over the age of 14, their foster parents come, and this can include kin, anybody that's involved with the child, any specialists, family advocates. We're required to do that. We're required to provide contact with the child and the family within 3 working days. And we're required to do this meeting within the 6 weeks to assess information gathered and revise action. We've changed this terminology to action plan and goals as necessary. So it's a time where we can kind of relook to why the child came into care, what are the issues, what is the family's understanding, kind of some mutual problem solving, hopefully some mutual understanding. We'll update an action plan and we'll work together with the family to try to meet their needs in the action plan to hopefully reunify with their child. Then we also have foster care reviews. These are formal processes for every child in care, and they happen every 6 months, as required by federal and state laws. And they create an opportunity for the family, when the child is 14 and older, in DCF to consider together the necessity and appropriateness of the child's placement, progress towards permanency in services, and tasks that may be useful. And then we have permanency planning conferences, and they are PPCs. So we're required to request a PPC as soon as the prognosis for reunification is poor, and we do have cases that fall into that category. Within the first 9 months, if a child is in placement, and 15 out of the last 22 months without an indication of why we are not initiating termination of parental rights. We must have a permanency planning conference to change a permanency plan if reunification does not look viable. We must have a permanency planning conference if a foster care review recommends a plan change. And we must have one within 5 working days when the court determines that we don't have to provide reasonable efforts on a case. Now, at permanency planning conferences, we will ultimately make a determination as to the child's goal. And these are our permanent plans that we will select. The first one is permanency through stabilization of the family. That's our ideal goal, and that happens when a child has already reunified back home safely. Another one is permanency through reunification, which is the first goal that we always identify and we always look for if the child comes into care, and we continue to work towards that goal. However, as discussed earlier, when prognosis is poor and we talk about concurrent planning, goals of adoption could also be chosen, goals of guardianship, goals of permanency with care with kin, and goals of alternative permanent plan living arrangement, which we call APLA, and those are for children over 16. So what does this all mean? It means we're looking at safety, permanency, and well-being of the child. And this is where I'm going to pass over the torch to June Reedy, our other supervisor at the agency, to continue with some of our work that we do. June.
Hi, all. I'm noticing that we have questions already posting, and I saw that Dr. Solomon has kindly said, hey guys, we're running out of time. So I'm going to I'm quickly moving through some of these pieces, and really there are a few parts that I'm going to stop on because I felt that it was important to share. And I did also want to express it is truly an honor to be here with you all and to be part of this presentation. So as I move forward, Christina, I'm just going to kind of move a little quickly. The overall sense is that we want to walk away with is that that DCF has practice expectations. We really do look at critical thinking and a clinical formulation. We make a team-based decision. We have a basic analysis and quality oversight in every facet of the department. So whether you're the person taking the report or the person planning for permanency, really our guidelines and how we work with families is really through this lens. So Christina, we can skip over those. So I want to really kind of stress and emphasize that one of the parts of our infrastructure that's important is the clinical formulation, where we look at families' needs as well as families' needs and their perspective as well as the department. So when we are concerned for abuse and neglect, we partner with the family to create a plan that includes the family voice. It also includes their family specific needs, whether it's regarding concerns for substance use, whether it's concerns for domestic violence. We work at this as a team decision. We use both the department social worker, the supervisor, and then we have a manager who oversees that. So when problem solving, we include the family, and as a team, we try to make a decision on how can we keep this child protected. How can the family and the community services become a part of this process to ensure that the family is safe? Christine, I'm sure you're kind of like, where are you? Because I'm trying to move quickly through what we had left, and just so we can get to some questions. I know that we are truly running out of time. Another part that I want to make sure that we touch base upon is that, we recognize that each of us have our own personal set of values and their beliefs, and we have to be mindful in our decision making frequently, and because we experience families and throughout Massachusetts. I'll speak specifically in the Bedford area office, from many cultures, that have many ethnicities and cultures, and we have to be mindful and we are most important taking their culture and looking at their values. What are the norms from that culture and their beliefs and their traditions, and how can we ensure that we're keeping the integrity of who we are servicing in their core values, in addition to keeping child safety? That there are many factors in cultural influences that we have to look at. What is the home and living? What is their health and well-being, their values, or how they practice this? We look at, their relationships and work, and challenges that may be from being a person who, if you are a person in the country and you are unable to access what we have as services, if you, how can we help support that? Are there any resources that we have, and how do we take pause in noting that, while we're concerned about, the concern may be we've had worries about an appropriate caretaker. However, your challenge may be that you are trying to work and support and provide your family and are not eligible for childcare. So how can we look at that? We wanted you to walk away with, there are many sectors of the department and specialties and support units. It is such a large area as we've done this overview, but that really it's been such a sophisticated area in looking at behavioral mental health, looking at domestic violence, early childhood, educational services and supports, health and medical services, housing and stabilization, human trafficking, substance use, and trauma-informed practices. So we really have many support units that help us to identify concerns that our families are facing, which may have led or have impacted abuse or neglect. There are internal resources and external resources, and a lot of our internal resources that we use, we are trying to not just look at what the problem is, but how can we provide supports long term? There are many times that we have a family for a small amount of time, and we want to provide these long-term supports that they can function and stabilize on their own with their own community supports. So we have, fortunately, and we're proud of some of the services that we're able to provide internally, which gives the family a parent mentor, someone who works one-on-one with the family, or support and stabilization services, which creates a few different providers into that home to do direct service to help address the concerns for why they've come in. As you go through, there are multiple internal services, but for the time's sake, I wanted to make sure that we were clear that the department helps with services both in the home and outpatient. We look at referring children to therapy and psychiatry, and sometimes, you know, due to mental health, they may need hospital evaluations or specialized treatment groups. We make referrals for parents to receive therapy for substance abuse treatment or education on substance abuse treatment, and medication assisted treatment. So, you know, will they need methadone or Suboxone or Rivotril to help them if they're struggling with substance abuse? There's domestic violence services that we have in our community to really help with individual support for both children and families who may have experienced trauma and violence. And we have, we're proud of one of our partners, which is the Family Resource and Development Center. That section is one that is often attached after the department is involved. And it can be used while we are still involved, but quite frequently we are attached after involvement. We can say, you no longer have concerns for the risk of abuse and neglect, but this could be a support for you and your family to access community supports if you have questions. We have a program called Nurturing Fathers, where we support fathers and encourage them, and we have one-on-one groups. And we have Parenting in America, which I've had a hand in, and we're proud that we were able to offer it a few times, which really looks at our families throughout the community who are not versed on the Massachusetts laws or the Commonwealth or the United States understanding of assimilation here, and how that may be different for them, and how through this program, how we help them continue with their identity and respect their culture and still merge that with the concerns or education on parenting here with the families. So I appreciate your time. That is a very condensed version of what I wanted to do and say, but for the respective time and wanting to be able to hear what you have to say, I appreciate you listening. And that is all we have.
June, thank you. And Christina, if you could stop sharing, we'll come back to the gap. There's a ton of questions in the chat, and I'm gonna ask my colleague Megan to help me sort through those questions. And yeah, so let's go to the questions.
Yeah, we've got only about 10 minutes left because we have another session after this. So we'll begin with Simche's question. So Simche works in social services in Sierra Leone, and she has actually a few dimensions to her question. The first is about training for foster parents. She asks if you have sort of a roster of already trained foster parents, how that works. And then secondly, how the process of licensing social workers works. She said that her Ministry of Gender and Children's Affairs in Sierra Leone has attempted that in the past, but had difficulties with licensing procedures. So thinking about training foster parents and the process of licensing social work professionals. Thank you.
Sure. So with that, I'd like to maybe invite some of our staff that might be on the panel here that might be able to answer things well, even though I'm pretty well versed myself. So Sarah, I'm wondering whether you feel comfortable talking about the foster parent licensing part.
Yes, so we do have, the department does have several foster parents that are licensed, and then we're always recruiting. So we do have a recruiter to recruit for new homes. And once they pass kind of all the preliminary background checks and physical standards of the home, they do attend a training. It's 10 sessions. It's called MAP training. Don't ask me exactly what it stands for. It's Massachusetts something.
Approach to Positive Parenting.
Approach to Positive Parenting. And they attend that training. And the training has several parts to it, around trauma, around why kids come into care. And once they're done with that training, they are able to take on kids in their home.
And we also do explore kin and we do explore what we call child-specific resources. So if there are individuals that meet our eligibility standards, they can come forward for us to train and for us to make sure that they meet eligibility standards to also become foster parents within our agency for the kids that come into care. With regards to the licensing of social workers, I believe that that was the part 2 question. The licensing is within 6 months of, one, it has to be a degree, at least a bachelor's degree in a social service field. And then within 6 months of hiring, the social worker does have to pass a Massachusetts licensing exam. In Massachusetts, there are several levels of the examination. The social workers only have to take the associate level, which is the lowest level of the examination, and pass. And that will be in their probation period to maintain their employment within our agency. And that's how we work as far as employing our social workers and getting them licensed, because Massachusetts does require our DCF social workers to be licensed within our agency.
Thank you. We have a couple of questions from fellows about the relationship between DCF and the police. We have a number of fellows who work in legal fields and law enforcement. So if you could say a little bit more about that, what's the relationship with the police?
Sure. And feel free, anybody as far as DCF that's on that would like to also collaborate. We have a positive relationship with the police. We often work hand in hand with them, especially with regards to high risk cases. Many of our removals, if we have to do a removal of a child, are usually on an emergency basis, and we do require, well, not necessarily require, but we do highly support police presence, because the situation can become very volatile in certain situations. We also have a close relationship with the district attorney's office and the police when it comes to maybe prosecuting charges that are really severe in nature when it comes to child abuse. So we work well with the police department there. We also work well with the police with regards to their, any commercial sex trafficking that's occurring with minors and with children, maybe that are in our care, or adolescents that are not necessarily where they're supposed to be, and we're trying to locate them because they may be missing or absent from where they're supposed to be. So overall, our relationship as an agency seems to be positive with DCF. I'm not sure if families always feel that they're positive interactions, but I think that also depends on the dynamics that the families are facing and what brought the police involvement in the first place, if that answers the question on a brief level.
Absolutely, thank you. Yeah, and one other question that seems to be coming up, and a number of these questions and comments pertains to data and sort of data management. So first of all, sort of how do you preserve confidentiality when you're dealing with this very sensitive data? And what kind of insights does data collection enable you to make in terms of preventing abuse of children in the future?
Sure. So we do have our internal data system in which, only an employee has access to. We do respect confidentiality, that unless a case is assigned to you and you have the authority to be in the case to access the information, that information remains confidential in our data system. All our data is placed in that system, and then our central office, which is in Boston, does have a data unit that collects many forms of data and then provides certain reports into whether to ensure that, for example, our children have to be seen at least once a month. So to make sure that we are conducting our home visits with our families, there are data to look at how many reports are being filed, how many reports are being screened in, how many reports are being screened out, how many reports are being supported, how many cases that we have open at one time, how many children are in foster care. We have several mechanisms of data that is collected from our central office's data unit that we have access to really compile and analyze the data to make some system changes where necessary.
I actually took that question a little differently, and I just to add to that, I also want to be clear, because on one of them, if I read correctly, it was also talking about during the investigation process. So really, there's another separate sector to information and sensitivity. We in the investigation in 51A process, what opens up our report, we are able to contact schools and doctors and collaterals during the investigation period, without a release of information. So there is still HIPAA, which are Massachusetts protected laws that require certain sensitive and personal information that don't necessarily, that the doctor's offices do not have to provide. So two types of information that are very sensitive that we often struggle with getting without a release of information, even in the investigation process, is, and I think that Betsy could kind of speak to that, but would be information about medical determinations or substance abuse treatment. We often struggle because they have hard, fast laws regarding that. However, we are able to access schools and we are able to access therapy to ensure that children are enrolled. It becomes a fine line. However, the last piece of this is that through the next step, which is the ongoing process, that's part of our assessment. We want to work with families and hear what's happening, and we need permission then from them. So a family has the right to say, you cannot talk to my daughter's school or my son's school. You cannot call my therapist. And I think it's a very fine line, but there are protections once we've moved past the investigation process where families can deny that service or deny access to such personal information.
Thank you. That's very useful. And that connects to some of the other questions that are popping up around sort of how you combat stigma and sort of discomfort and fear that families might have in interacting with these agencies. There's another kind of cluster of questions we'll wrap up with that, about children's experiences of foster care. So we had one question around, what happens if children report experiencing abuse or neglect or simply discomfort with their foster care placement? How are the children's voices heard and responded to? And then also another interesting question is, are there interstate foster care placements ever, or is this all done within the state of Massachusetts?
Okay. So the experience in foster care, I think it depends on the youth. I mean, we've had plenty of youth have had great experiences in foster care, and then we've had youth that have had not so great experiences in foster care. However, we hold foster parents to the same standard that we hold birth parents to. So if there is a concern of maltreatment in a foster home, then we will also file a report on a foster parent for it to be investigated to ensure that the child is being appropriately cared for in foster care. But we have had many youth with positive experiences. We are able to support a youth even if they age out of foster care post the age of 18 up until the age of 22. So as years have gone by, we have spent a lot of time, focus, and energy to ensure that youth at the age of 18, if they don't have a permanent plan or a place to go, that we continue to provide support to them. And in many cases, we have children who have gone on to college and made them very successful careers, whether it be through the support of their foster families or through families, kinship families or child-specific families that have been their foster home placements. So I am sure that we have tons of examples of very positive experiences in foster care. Our aim is to provide very high care for our children in care. So I hope that does answer that question. What was the part two?
Just if all foster care placements are within Massachusetts or within the same kind of region of Massachusetts, how the geography plays out there.
So ideally, we look for foster homes geographically in this around the area of where their birth family is. So we're in the southeast region of Massachusetts. We'd be ideally looking for something within the same city, a neighboring city, or in the southeast region. However, we will have to say that foster families, we're struggling with retaining foster families and as well as recruiting foster families. So because of that, children have gone to other regions of the state and being able to not necessarily be geographically maybe close to their birth family. And there are times that, especially if there are family members out of state, where we would initiate what we call an interstate compact placement request. It's called an ICPC. It's a federal law that all the states in Massachusetts, I'm sorry, all the states in the United States participate in to govern how kids in one state's jurisdiction could possibly be placed in another state's jurisdiction. And that is a whole process that we have to follow through the ICPC laws. But that does happen. It doesn't happen right away because there is a formal process of the other state accepting the child into their state if they're a ward of Massachusetts, but it does happen. And I will have to say, I mean, I have several of children right now in out-of-state families.
One of the things that I wanted to interject and add very, very briefly, but I feel is extremely important, is when we're talking about the removal of a child, we always have to realize and take in consideration the traumatic impact that has upon the disruption of the family versus long-term, immediate, or short-term. So the department's goal is to make sure that we are always using, to the best of our acknowledgement, reasonable efforts by providing all these services, making sure we join with the parents, making sure that we really look at them through an intersectional lens and try to team together in order to prevent that. So it is only in the utmost cases that we would definitely look to that route when we have reached all efforts towards maintaining the stabilization of a family. And even when we do that, we have to present those reasonable efforts and those facts in a documented report through our attorneys, and it has to reach our judicial system where they will look and take all that into consideration as to whether or not we have met that burden at all costs to ensure that we have put in all the proper tools and services needed to maintain that stability. So it is very, very challenging to get to that point. And sometimes when we get there, we always take into consideration the needs of the family and if they have any support, because the placement with kin is so much more crucial at any moment in time to ensure that we can hopefully bridge that gap towards reunification and permanency for the kin, which would be the first.
Thank you. And I think that's a wonderful note on which to conclude. Thank you. Jabril, did you want to add on anything?
Yeah, no, I mean, I said thank you so much to Christina and June and Betsy and Sarah. I'm sure I'm missing someone from your team. Rima, is it Rima? This was wonderful, wonderful presentation. Fellows, you ask a lot of questions in the chat. Christina, hopefully you'll share a copy of the presentation with me and we can make it available to the fellows with your contact information. But I'm hoping that for you fellows, this was an opportunity for you to sort of realize and see how a state and government agency works with communities and works to support families and children at all different levels. I know there was a lot of information, but I'm hoping that this is a model that you can think about as you create and work through your own system in your own countries. Wonderful, great. Thank you so much for joining us. And we are running out of time. We're transitioning to our very next presentation. But we will be in touch. We will be in touch.
Thank you all so much. Thank you. And
It was an honor.
It was an honor. Thank you.
Thank you so much. Thank you, Christina. Thank you, June.
Great, thank you.
Thank you,
We'll
Betsy.
see fellows at Harvard on our next Zoom link.
All right, fellows, we'll see you at Harvard in a few minutes.
Thank you.
Thank you so much for the presentation.
Very good.
Thank you.
All right, we'll see you soon.
Okay. Should we log out and log in the next?
Yeah, you log out and use the other link for the Harvard presentation. All right, everybody's good? Yeah, thank you, Sharma. So you'll log out and we'll see you at the Harvard presentation.